सभी का ख्याल रखते हो। बस लक्ष्य है सेवा, सेवा से कभी ना थकते हो। नहीं जान की परवाह, निकले हो जान बचाने को। तुम रोक ही लोगे आंधी जो है आने को। शुक्रिया भारत के योद्धाओं, एमक्योर करे सलाम आपको। शुक्रिया भारत के योद्धाओं, एमक्योर करे सलाम आपको। कैसी ये जंग है, पड़ी मौत सांसों के पीछे। बने तुम जो मसीहा, जगी जिंदगी में उम्मीदें। वहाँ वीर खड़े हैं उन सरहदों की रक्षा में। यहाँ आप डटे हैं इंडिया की सुरक्षा में। शुक्रिया भारत के योद्धाओं, एमक्योर करे सलाम आपको। शुक्रिया भारत के योद्धाओं, एमक्योर करे सलाम आपको। एमक्योर करे सलाम आपको।
Good evening and warm greetings. I am Dr. Omkar Swami on behalf of Emcure Pharmaceuticals Limited. Welcome you all in this very exceptional program of Ferium XT Icons of India. Friends, today is Guru Purnima and very auspicious day in our culture. It is well said that modesty yields service. Service to Guru yields knowledge. Knowledge yields detachment, and detachment yields salvation. And therefore we require the Guru, and in our culture there is a very much importance of Guru after our parents. So we at Emcure presenting you once in a life experience to meet icons and gurus of the medical fraternity on one platform. I would like to extend my gratitude to all the senior dignitaries and living legends participating in this program. To cherish this moment, we have Professor Niranjan Chavan sir from Lokmanya Tilak Medical College and Sion Hospital, who will be bring out the pearls of wisdom and experience to inspire from all these gurus. We feel hosting of this meeting is a really honor for Emcure, and we look forward for further such events in future as well. Thank you very much. And with this, I would like to hand over to Professor Niranjan Chavan sir. Over to you, sir.
Thank you. Good evening. Welcome. Vanakkam. And it is a great opportunity today. It's a once in lifetime experience that we meet the icons of obstetrics and gynecology. And I would like to thank Ferium XT and the makers of Ferium XT, that is Emcure, Science Integra, to deliver this on the TOG webinar, the #1 platform pan India and across the globe. And coincidentally, today it is a Guru Purnima day. It's basically a biggest day for us, and I would like to say here the Sanskrit verse: Guru the Brahma, Guru the Vishnu, Guru the Devo Maheshwara, Guru the Sakshat. Today my gurus, the Sakshat gurus, have come here to talk with me, and this is the best honor. So Guru the Sakshat Parabrahma Tasmai Shri Guruve Namaha. So I would like to give them Shat Pranam to this wonderful people who have joined us, and welcome all of you on this historical day where we all get an opportunity to hear it, feel it, and see it from our own seniors who have dedicated more than 40 to 50 to 60 years of their life for us, and they have taught lakhs and lakhs of students for so many years. So This is a wonderful occasion, and I welcome our gurus today who are present, the icons of India. And we have Dr. R.P. Sunawala sir. He has been practicing in Bridge Candy, Jaslok Hospital, and we have already seen him, heard him, but today he is going to talk specially to all of you on this platform. He is a pioneer, and in 1956 he has invented Sunawala's loop, and we are going to travel through that mystic era and the decade where there were many women with septic abortion. We are going to see and hear and feel Dr. C.N. Purandare sir. C.N. Purandare sir is known as Chitranjan Narhari Purandare, and we are going to talk his journey in Figo. Dr. Balamba, who is there practicing in Hyderabad, and she has been there for 50 years. We are going to talk with her too. And we have got Dr. Atul Munshi. He is a pioneer in giving the financial incision in that era in the state of Gujarat, and as trial on anemia and pregnancy. We're going to hear live and see him. We're going to also be joined by Dr. J.B. Sharma. He has his commitment today with some exam, but I'm sure he will join us. Dr. B.N. Chakravarti has sent his apologies because of his medical issue, but I'm sure the next program is going to join us very soon. So we come. Yes, I can see J.B. Sharma, sir.
Hi, sir.
All of you. Thank you, all of you, to be there.
For getting me.
Thank you so much. So, Dr. R.P. Sunawala, sir, we would like to start with you. I hope you can hear me. And whole India is hearing you. Sir, we want to see and hear the experience of your journey and that one unique case which you had in those era of 1956, which you just conversed with me yesterday. Please elaborate on that, sir. What was that one unique case? And each one of you, I want to ask that one unique case. Yes, sir.
This was a couple from Ranchi. They had a first baby by lower segment cesarean section. Then she developed an ectopic which ruptured, and they had done one side salpingo oophorectomy. I was a little surprised why oophorectomy, but at that situation, maybe that it was too bad, and whoever the surgeon was had to think of saving the life of the patient. Then they were trying and no pregnancy, so they came to me for treatment of infertility, and she had severe pain during the periods. So we did ultrasound, then decided on laparoscopy and laparotomy, because there was on the opposite side bad endometriosis. The tube was all puckered up, the ovary was all covered with adhesions. Ectopic and the C-section had created a certain amount of adhesion. So we cleared all the things. And she went back to Ranchi. They were pretty well off, because every time they would come with a doctor and a nurse, the parents of the girl, parents of the boy, and the couple themselves. And they used to spend at least 10-15 days in Bombay minimum. Then there was no pregnancy. They were trying hard. They were not keen to go for IVF because they had enough experience and surgeries for the lady. The pain became more and more and more. So after 7 years, they came again, and the endometriosis had grown a lot. And the life of the couple was grossly handicapped because of the pain. Normal sex life was not possible. The pain was too much. So we counseled them, and she was by the time around 30 plus, 33, 34. So we counseled, okay, we'll have to do a surgery and we will decide whether the other side, tube and ovary, are good enough to be saved or to be removed. So every very good counseling was done, and both husband and wife, because I was not interested in trying to get opinion from the couple's parents and all. The couple itself is more important. And they both agreed, okay, whatever you do, but this pain has to go. Every day she was in severe pain. So we took her up and we were absolutely surprised. The opposite side, tube and ovary, were like a mated mass. So we counseled, the husband was in the theatre with me. He asked him and we operated and removed the opposite side tube, bit of the ovary we could save, which we left in. Then the question was that they had also opted, okay, even if you think to remove the uterus, you can do it. But at that age, I was not keen to remove the uterus. The uterus looked a little suspicious, bulky, but nothing much to indicate that it should be removed. Because their thinking was already so many operations and one more operation to remove the ovary. We are not very keen. But somehow, when I discussed it with the colleagues, the anesthetists, the assistants, they all said, remove the uterus, because everyone was in a bit of a mess. But something just told me, no, let's not remove, because one can do an embryo transfer and they can have a second baby. Then they went back to Ranchi. And then at Ranchi, the doctor who had come with them phoned me after a month, okay, she's vomiting. So I said it might be the hormone withdrawal. So I asked them to give them Tricula as a HRT. She took Tricula, the matter became worse, she was vomiting a lot more. Then once the Tricula was withdrawn, there was no period. And she was getting little pain in the abdomen. So I asked for an ultrasound, thinking it might be a bowel loop obstruction or something like that. So when they did the ultrasound, to our surprise, it was a pregnancy. So there was a question whether to terminate or not. Definitely I said no. Her ovarian reserve was very low. And we did the progesterone and beta-HCG and all. And progesterone was practically very, very low. So that was a dilemma in my mind, whether to give a progesterone supplement or not. So I thought, okay, if the pregnancy is having an anomaly, and to support that pregnancy is not very wise. So we did not give any treatment at all. And she had taken Tricula for a month, practically. Then the pregnancy continued mildly. The vomiting became less after the third month. And then they came back for delivery and we did a C-section. And at that time of the surgery, when we operated on the tube and ovary, it was impossible to suspect a pregnancy. So when I spoke with the husband, he said, yes, we had no sex for 6 months. And just before leaving for Bombay, one night we had sex. So if God wishes for a pregnancy, even through a grossly mass, this pregnancy had started and started in the uterus itself, not in the tube. Then we delivered the baby. The baby is now must be around 25 and we are following up. Nothing is wrong with the baby. The moral of the story is that we think progesterone is a must for supporting a pregnancy. The present generation, moment a lady goes and says, I'm pregnant, how many weeks 5 weeks, 6 weeks, straight away replacement for progesterone is being prescribed. I don't think that is the right thing. One should abstain away from drugs unless it is properly indicated. And the second thing is that if God wishes, I believe a lot in prayers. If God wishes, a pregnancy can start in the uterus with a very damaged and a faulty tube as well. So this was a case which really shook common sense how a pregnancy started.
Absolutely great to hear from you, sir. This was a very interesting case in Ranchi which you have done, and I'm sure the first icon today, Dr. R.P. Soonawala, has gone through, and this was a case which was an obstetric sudden collapse, and how we dealt with a VIP patient. And sir, it was amazing to hear from you those pearls of wisdom coming from you. Thank you so much. Sir, one more thing I want to ask you. Your invention of the Soonawala's loop, and we have read it when we were undergraduate students. So please, sir, may I request the organizers to show the slide, and Rustam Soonawala sir will talk on that. Mic is yours, sir.
Yeah. Is there time enough for everyone?
Yes.
No. When I started practice in 1963, I had a VVIP patient. We delivered her. Normal, everything went off well. Then they came for counseling for family planning or planning, avoiding a second pregnancy for a while. And at that time, I was carrying out a study with ICMR as a freshly returned foreign student. They used to give 700 rupees stipend and give us a small project to do. I was doing a project on oral contraceptive. At that time, Enola was the tablet, 10 milligram of the drug. Nowadays, we get 0.5 and 0.3. That was the first tablet that was introduced. And we discussed, and they wanted an IUD. A colleague of mine at Nair Hospital was carrying out an IUD study. So I went to her and requested for an IUD to use for my patient. And I was told, no, it's a study I cannot give, and it will be difficult if by chance perforation, this and that. And I was getting very upset. After working at Wadia, doing hundreds of C-sections and having fellowship from London, I can't put an IUD in. What was nonsense. I was very upset by that. I had promised that little girl after a month will give IUD. And that night I went to my friend's house for dinner, Mr. Chandrakant, late Mr. Chandrakant Garwal. And we used to be great friends, and meet every now and then. So that night he just said, what is wrong? Why are you looking so upset and depressed and all? So I narrated the whole story. And they were the pioneers of plastics in it at that time. He said, what is it? I explained a plastic coil like this, like that. So he said, come to the factory tomorrow morning and we'll make whatever you want. And that started off the design. And then whether to design like a Margulies or a Lippies, the thought came that there might be litigation because they were holding patents. So I changed it into an S shape. And then naturally the inserter, the pull down technique, and all was introduced by me. And that we used to use for a long time till the copper devices and the Pop Council from US and the USA from US started supplying free IUDs for use. And that's why there was no, say, incentive to continue working more on it.
Thank you, sir. And we are very proud that you have made this invention and saved many women in those days with coming with septic abortions repeatedly, and there was hardly any family planning in those days in 1950s. And we are very proud to hear and see that Sunawala's loop, which is currently on display in the Museum of Contraception and Abortion, Vienna. We will get back to you soon, sir. Now I come to the icon of India, none other than Dr. Chittaranjan Narahari Purandare. Sir has taken India on the world map by being the FIGO president, and it's a great honor that, sir, you have been here with us. Welcome, sir, on this occasion of Guru Purnima. You have put the crown, the jewel of India. You are the Kohinoor, I can say that, and we want to hear those pearls from you, sir. We want to find out and we want to know how that FIGO election was there, which you conquered and took India on the world map. And everyone is eager. The nation wants to know. We have got more than 1250 members live logged in right now. Sir, the mic is yours.
Sir, we are unable to hear you.
Sir, you will have to unmute your mic. Yes, sir. We need to unmute your mic, sir. We need to hear you. We are unable to hear you, sir. We can see your video. Can the host unmute the mic, please? Sir, you will have to unmute the mic. Yes. There is a button, sir. Can you listen to us? Yeah, please. There is a button, 3 dots on your screen, and you can just go on that and unmute it. Or at the lower end of the whole panel, there is a mute and unmute button which is adjacent to the stop video on the lower end, on the left hand side, sir. You will have to just unmute that.
Dr. Purandare, we are not able to detect any audio from your instrument. May I request you to just log in again, sir, preferably, because we are not able to detect any audio, or connect a headphone, sir, preferably.
Sir, we can't hear you. Thank you so much. We will come back. This is what happens when we are in an era and unlocking of lockdown is happening, and there are going to be some technical glitches. But I want you to be there. We'll be getting back Dr. Chittaranjan Narahari Purandare. Now we go to the next icon, and we have with us the Iron Lady from Hyderabad. I can say she has a practice of 50 years, and I met her last October when I had gone to deliver a lecture and conduct a CME with Hyderabad Society in Telangana along with Dr. Shanta Kumari madam, and I saw a lady sitting there in the front chair, and the way the discussion was going on and I was asked the questions and I could answer them, I realized she is a woman with a lot of wisdom, a lot of knowledge, and we are going to hear from now Dr. Balamma madam. Dr. Balamma is going to be here with us, and I am really happy to get her on board today on Guru Purnima. She has contributed a lot, and we are going to hear something from her. Dr. Balamma madam, would you please share your experience about your case and the HIV experience.
Thank you, Dr. Niranjan. Thank you very much. See, the case was, she came to me, a young woman of 26 years. She came to me about 6 months ago, and she already had a laparoscopic myomectomy. She was unable to conceive, and she came to me after the 3 years of laparoscopic myomectomy. And when we examined her, we found that the uterus is enlarged to about 28-week gravid size and multiple fibroids. So I said she needs to go for myomectomy again if she wants to conceive. And I don't know whether I can preserve the uterus or not. This is what we have to counsel them, because there is always an off chance that we may have to proceed with a hysterectomy in case of multiple fibroids. So that is what we explained to her. And then she went away because I think she was scared of going in for a hysterectomy. I said, we always will preserve your ovaries. You may go in for a surrogacy. That should not be a problem. But then she didn't come back. She came back to me again in February. And in February, when we examined her, it had grown a little further. But by then, we decided, we investigated, and all that, the lockdown started. And once the lockdown started, we had to postpone the surgery. And in June, when I went back to the OPD, she came back, knowing that I am back there. And then we decided for the surgery. So once we operated on her, we explained that we may have to again go to the myomectomy, and myomectomy, we'll have to map where the myomas are. So we sent her for a scan, and with a very good sonologist, and he told me that there are only 8 fibroids: the intramural, subserous, posterior, anterior walls, and we sent her for an MRI also to map the fibroids, so that we can go ahead and do it. And then when we did that, once I opened her, to my surprise, we gave an incision first on the anterior wall and started enucleating the fibroids. The fibroids went on coming. It was like, a flood going on coming, and I was scared where I'll have to go through a hysterectomy, because one after another they were rolling out, and the same incision, we had to go and we are doing a tunneling incisions, taking them out. Then I had to open the endometrial cavity also. And instead of 8, we had 82 fibroids of different sizes.
Oh my God.
So these 82 fibroids we removed, and I could save the uterus, but then I don't know whether she'll be able to conceive or not, and I was worried whether she is going to have her periods also, because I opened into the endometrial cavity and I don't know what I did with that. And then, we closed her and she became all right and she went back home. She came back. She came back in the end of June. We did it on the 1st of June, and she came back at the end of the June with a period. She had a menstrual period. Then I was happy. And of course, I don't know what she is going to plan, because she has to wait before she plans a pregnancy for some more time. I said, at least for 3 months, you're not planning a pregnancy, and afterwards we will see. I don't know whether she'll conceive naturally or she'll have to go for a aortic procedure. So this was a very interesting case, and what I would like to tell the audience is, don't believe the scans or the MRIs. After all, they're all shadows. You must be prepared for surprises inside the abdomen. It's a Pandora's box, and you have to be prepared for doing what is best for the patient. And before that, counseling is very, very important. So you will have to talk to these people. And of course, the husband was inside the theater, and he was also surprised that so many myomas were rolling out, as we were going on. So from 8 centimeters fibroid to 1 centimeter fibroid, we removed 82 fibroids.
Thank you, madam. Madam, I am getting goosebumps. I can't believe such a thing can happen. And thanks to that sonologist who missed those 82 fibroids, and it just multiplied 10 times. And I appreciate the amount of energy at this age you have done. we grow old, but we are always young, and young at heart, young and physically. Just in the afternoon, I got a call from our MOGS Youth Council. Sir, we are having the Youngistan, MOGS Youngistan on 19th of July. And I said, I am also going to be there as a part of it. So, madam, it was wonderful. Can you share us your experience about HIV, which you conversed with me?
So this in 1996, when we had our HIV patients coming in pregnant, that is when the Thai protocol was started in 11 centers in all over India. We had NACO, National AIDS Control Project, and we also had AP, Society of AIDS Control Project. And everyone was scared. Now as we are scared of COVID, those days everyone was scared of HIV. And every HIV patient, had to go through a section. That is what was first in the beginning, everyone thought. But then when Thai protocol started, we gave them these drugs, zidovudine drugs, and then, we went ahead and delivered them. And WHO said we can even allow them to breastfeed also. And when the patient came to our hospital, I was working in Institute of Obstetrics and Gynecology as a 5th unit professor, nobody wanted to touch the patient. Everyone was scared. So then the superintendent asked, medical superintendent asked me, what would you like to do? I said, all right, if everyone is scared, I would like to do it. And of course, we all had to wear those PPE kits which we are wearing now. Nowadays, so we had to wear, we had to take universal precautions. And then we started that, and I headed that project. So we did the study on Thai protocol. And then, I told all the assistant professors and postgraduates, we are going to have a roster so that, no patient is going to be turned away. And you will be doing that in order, one after another. You will take care of these patients. And we trained all the medical colleges in Erstwhile Andhra Pradesh and also all the private medical colleges. And I'm still associated with an anti-trafficking agency, the Prajwala, where we have lots of these trafficked women who are HIV positive, So I used to take care of them also. And then the government asked us to train counselors to be in our hospitals, and we trained 108 counselors in HIV counseling, And now, of course, no government doctor is scared of conducting a delivery in a HIV positive woman. And the days also came when we started getting discarded couples, and where, the women were positive, the men were negative. And that also we had to manage. It required a lot of counseling. And now very few private hospitals, even in Hyderabad, take up HIV positive women for either gynec problem or for obstetric problem. And I'm still continuing to take care of them.
Wonderful, madam, that experience which you shared, and I am sure similarly COVID will be eradicated in few months' time, and we will be getting the vaccine soon, launched by Government of India by August 15. Thank you so much. And now we have the next legend, the icon of India, Dr. Chittaranjan Narahari Purandare, and he is going to tell us about his journey. Welcome back, sir. We can understand there are going to be glitches and the connection being lost. But sir, you have taken India on the world map. We are very proud of you, and we are very, very happy to see you here today on this Icons of India on the day of Guru Purnima. Sir, we want to know, the audience wants to know, the nation wants to know, sir, how you came in Figo with such an enigmatic personality, and the way you marched ahead and took India. The nation wants to know about Figo and the elections. Mic is yours.
2012, when the elections were on in Rome, nomination had to be sent from Foxy to those positions. And I must give credit to P.C. Mahapatra, because he was the
president that time, and we were thinking in terms of going in for the Secretary General's job. And PC Mahapatra said that CN, you are not going for any other job but the president job. And I said to him, look, there have been two presidents from India. The last Asia Oceania region president has been Dr. Shirish Shet, and it would be impossible to fight at that level. So he said, it doesn't matter. You have to go ahead with that. And I finally did put in my papers for the president of FIGO. And there were four candidates, one from China, one from New Zealand, one from Malaysia, and then one from India. And to our surprise, the Chinese, you know how they have been functioning even today. We see in Galwan, all the presidents of the world who were going to be their voters were sent a complete huge bone China set so that they would support China for the FIGO election. I couldn't believe that anybody could do a thing like that, but that's the way they function. And when we went for the election, Malaysia dropped out first, and it's always 1-1 eventually because the lowest person drops out. New Zealand lost the election next. And then it was between India and China. And when it came to India and China, I got 60% vote while 40% were for China. And I got the position as president of FIGO. And when the results were announced, Narendra Malhotra was in the hall with me when we were sitting there, and he was constantly taking pictures of all the results that were coming in from when Malaysia dropped out, when New Zealand dropped out, and he was sending them out to our Indian delegates who were waiting outside. And when the last result came out, he sent the result out, and the entire audience couldn't believe that there was one gentleman who was standing up and saying hooray, 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 and that was P.K. Shah in the entire general body. And that was something which I will remember all throughout. And that really paved my way to go into as the executive and the trustee of the FIGO. But believe me that it's not an easy journey to lead the international organizations with most of them being whites, and we are very minuscule colored people there in the trustees. When before the day I took over, one of the past presidents came up to me and said, well, if you have to survive here as a president, you will have to, he named 3 white women. He said, you will have to continuously say yes to them and please them. Then only you can remain as president of FIGO. And I said, I have been 25 years in Foxy and I have never been a yes man. And I don't expect, nobody should expect me to be a yes man being there as a FIGO president. And it went on that eventually we had, before my tenure, in the last 50 years, there were only 2 members of the committees, leave aside the chairperson of FIGO's committees. And when I took over, I said there has to be a complete transformation of FIGO where each and every country, it's not an organization run by UK and America and a few other European countries. It is an international organization. And each, if there are 10 committees, they should be distributed equally between Africa, Asia, Europe, and North America and the South America. And I distributed the chairpersons, I distributed the entire committee right throughout the whole committee, and that was a complete transformation of FIGO that took place. And I put it down in the constitution that this has to be put in as a standard protocol and nobody should be able to change that. And that has gone in there, and now even today all the chairpersons are of different regions and everybody is being given the opportunity to be a member of the committees and the chairs of FIGO. And those 3 years were very productive. We had more than 10 people on various committees, and we had 2 chairpersons there from India, and I'm proud that they all made me proud because they did wonderful work in FIGO and really established India's image all over the world. And that image was when I went to WHO, and today also even the WHO chief and everybody are constantly in touch with me. They have become my friends, and at United Nations as well. And it has been a great experience. And one important thing that I remember, which I must tell you, that after I came out as winner at the FIGO meeting, there was one gentleman which was waiting outside, and he came up to me and he said, "Congratulations, I'm very proud of you." And he was the Indian ambassador to Italy, and he was there, and he said that I'm proud that the Indian has beaten a Chinese. So that was something which I will remember again lifelong, how even the Indian ambassador to Italy was present there when this happened.
Amazing, amazing, sir. And that journey of your traveling and taking us back again to those days. And it was wonderful to see you there, sir, as a FIGO president. And I am very, very proud of you. And we all are very proud of you. And I want to tell you, sir, that today, Sunday evening, here Mumbai, it has rained cats and dogs. But from all over the world, we have got more than 1,800 members live, logged in, seeing on you, seeing all the icons on this wonderful TOG webinar platform, monitored and organized by Science Integra, supported and by Emcure. So thank you so much, sir. So one more thing we want to ask you is that what happened in the next 3 years of FIGO, sir, when you took over, and what was done for the women's health?
Well, during my tenure, we had a couple of things as a priority: the maternal mortality reduction, cervical cancer, early detection and vaccination that needed to be done, and contraception, the family planning that needed a boost. So FIGO took that initiative and certainly pushed it all over the world, these important aspects. And believe me, in 3 years, I visited 60 countries all over the world. And that's a huge amount of traveling. I don't think any president of FIGO has ever done that kind of work. People just take up the seat and maybe conduct 1 or 2 meetings, yes, and don't go over the world, thinking that why should they spend their time for an organization when they can make money outside in their private practice. But as my wife always says, that it has always been JJ as first family, then it was always Foxy, then FIGO, but actual family was the last in the time that I spent with everybody. But it was indeed a great pleasure to work for FIGO and put India on the map.
Sir, it was a wonderful way of connecting with all of us. And sir, we are very proud of you. Mumbai Obstetric and Gynecological Society and Foxy is very proud of you. And we are very proud that the way you have conducted, and we have seen that even after those 3 years of being in the office of FIGO, you have still been there as an immediate past president of FIGO. And thanks for being there with us. We will come back to you soon. Thank you so much. Now, I come upon to none other than the lion of Gujarat. Well, after Narendra Modi, I can say there is also one lion. He's very, he just is very cool. But when he is there, he is just there in Gujarat. And he has done wonderful study on anemia in rural India and in Gujarat specifically, anemia in pregnancy. And he is going to talk something which he has innovated. And that was something wonderful when he conversed with me, Dr. Atul Munshi sir.
Before Atul says something, I want to just add one important point about Atul, that we both share our birthday, and it's on the same day, and we always wish other every year during our birthdays.
Thank you very much to remind this.
Sir,
I'm going to talk about a rare case of advanced abdominal pregnancy with a live fetus. As you know that late secondary abdominal pregnancy are rare. And most of them are terminated these days quite early. We do not allow them to go to the full term. I'm going to share a few slides and I'll be showing you. This is the case which we got about 40 years back. And fortunately that child was live. And even today he is in my contact. He is at Canada. But still he is able to talk to me at times. And as Niranjan told me that you have to talk about a case. The first thing which struck me was on this day. It was a case of a 30-year lady in third year of her married life, spontaneous conception, no episode of vaginal bleeding. And first consultation at 12 weeks. She was from Mehsana, so she consulted there. In early third trimester, she complained of fetal movements and unusual pain. Her parents were staying in Ahmedabad. So she visited VS General Hospital, a tertiary center where I was working. It was in early 80s and USG was also very intense. The primary sonography showed 26 fetus in longitudinal breech presentation. The amniotic sac of fetus was visualized posterior to cervico-stomach region of the uterus and no distinct muscularis layer of uterine fundus surrounding pregnancy was seen. We thought there is something abnormal. We are not 100% sure what it was. Pre-operative MRI. MRI was done only at civil hospital at that time. It was not available everywhere. A fetus in longitudinal lie and breech presentation in abdominal cavity. Uterus anterolateral to the fetus and pregnancy sac was seen separately. Placenta visualization lateral and inferior to uterine fundus. The extensive pre-operative preparation was done. We had 3 units of blood ready because at that time components were not available. Senior obstetrician was informed advised to stay standby. Team of senior anesthesiologists also there, and preparation was general anesthesia. It was not safe to go for spinal anesthesia at that time. When we did operation, vertical pyramidal incision, careful peel of rectus sheath and everything was separated. The fetal sac was seen immediately, and floating fetus can be seen there. An emaciated fetus was delivered, and it was handed over to pediatrician. That time there was no neonatologist to separate. Child cried after initial resuscitation, and Apgar was 1 to 2, and then 6 to 7. In the operation that things were taken, you can see the sac just below that, and this is the abdominal part of the placenta. The thing comes afterwards. Exploration of the abdomen revealed that posterior to the uterine wall covering anterior sigmoid corner and the rectus sheath was there. Considering vascular attachment of vital organs active bleeding, the umbilical cord was cut based on excluding the placenta. The uterine and fallopian tube were normal and undamaged. We are not ready to remove the placenta, which was there because we do not have facility for that. Complete hemostasis was confirmed. There was no active bleeding. The abdomen was closed in layers. The surgical blood loss was approximately 600 ml. So blood transfusion was not given. The patient was transferred back to the maternity ward. After 5 days, the intraperitoneal thing was removed. Post-operatively, important thing is antibody was given for 5 days. Mifepristone was just introduced, so we have given it one. Beta HCG dropped from 1933 to, and on 12 days it has come down to 4411. So this was given for 5 days. Mifepristone was given. Follow-up after 15 days and 1 month was uneventful. Lactation was poorly established and top feeding was needed. This was a picture which I recently got. Is at Canada, and this is the first picture at the time of delivery. So lessons to be learned over here is abdominal pregnancy is a rare type of disease. 1% total number of ectopic. now not widely accepted is clinical criteria. For advanced abdominal pregnancy, placenta has to be removed if it is stable. There are different degrees of placenta growth restriction. Abdominal pregnancy can be easily missed, diagnosed even by good ultrasonography. MRI is the thing which can be done. With the early detection of artificial pregnancy is usually terminated. In advanced stages, monitor the fetus. If the time permits, as we did in this case, live child can be delivered. It is dangerous time to the baby. Placenta treatment should be individualized and colonization site. Current concept is to relieve relatively mild or slow necrotizing of placenta. Don't give very large doses of drugs. Standard thing is placenta can be removed after there is no bleeding, and after secondary surgery can be done after 3 months when all vascularity has been gone. Now people will keep it over here. Thank you very much.
Thank you. Wonderful, sir. It was such an amazing patient, and the guy is nothing less than a film star now looking. And sir, you have done something very, very different and very magical, and it was a miraculous. That's the reason you both share the birthdays together, because God wanted that to be those icons to be here with India. And we are very great. We have got more than 2,000 viewers now. I'm really impressed. I'm really very happy. And I just got a message from MCGM, my Deputy Municipal Commissioner. My Deputy Municipal Commissioner of Health Department, and he is very happy to see me conducting these icons. Yes, sir. You wanted to say something. Thank you. Thank you. So now we have, after Dr. Atul Munshi being there, we have Dr. J.B. Sharma from AIMS. Sir, I know you have been busy since morning, the whole day. You have been busy with exams, and you're going to show something very innovative, very different in the history today making. We are going to make history today. And Dr. J.B. Sharma is going to tell the innovative thing which he has done. And I'm sure it is going to be practiced all over India and abroad. Dr. J.B. Sharma, you're a pioneer. I met you 20 years back, and that's where we exchanged our mails. And I still remember your email ID. And it's so proud of you that you have been in the best premier institute the nation sees, and the way it conducts, and you have conducted a lot of deliveries of COVID. But today you are going to say something which is very near to your heart, and that is urogynecology. Please go ahead, sir.
Okay. Hello, sir. Can you hear me?
Yes, we can hear you.
Okay. Yeah, good afternoon, and Dr. Niranjan Chavan. I think if there is biggest icon in this, it is you. We must not forget. And I think I am the most, sober person out of all. I am not an icon at all. But definitely, yes, I try to be a reasonable gynecologist and to be teacher and a friendly person. And as you have said rightly, it has been a real pleasure to listen to other icons, Dr. Purandre, Dr. Sonawala. They have been our idols also, Dr. Atul Munshi. They are all friends, and I look towards them with this thing. So, sir, I became chairperson of Urogynec Committee, and recently you must have heard about this problems of mesh in prolapse surgery. So, and when I visited London actually last year, so they were, I was surprised that they were not using any TOT or tapes because they were not available anymore there because of the problem of mesh erosion. And then, so what to do? Either we do burst colpo suspension, that's also big operation, or should we go for some patient's own rectus fascia? And I'm happy that Dr. C.N. Purandre is sitting here. So from Purandre's rhicopexy, which we do, I took a clue from that, Dr. Purandre. So your family comes first there. So, from that Purandre's rhicopexy, so I took an idea. So why not to use that, rectus sheath patient's own fascia, we can use as a sling, which is free of cost for the patient, and it should not cause any problem for the patient. So I gave that thesis to my PG and we started. So initially there were some hitches and all, but ultimately we could stabilize things and all. So what ultimately we do, we put the patient under general anesthesia, lithotripsy position, and we cut a piece 8 centimeter into 1.5 to 2 centimeter. Rectus fascia is cut from both ends. Like in rectus Purandre's rhicopexy, normally it remains attached to the rectus sheath, and then we bring it to the anterior cervix there. But in this case, we just cut this, and then ultimately, so from below, we make about 2.5 centimeter incision on the anterior vaginal wall, just like we do in TOT and TVT or anterior repair what we are doing. And then from above, I open the abdomen, but not the peritoneal cavity, and the Polish catheter has already been put. And from above, then taking care of bladder, neck, and urethra, I basically, take this clamp from there, and I go on one side of the bladder neck there, and then my assistant from below make a tiny nick, or we can put the clamp straight away in the vagina, and then my assistant feeds me that rectus fascia which I had cut before, and on the stitches have been put on that. So ultimately, this tape goes like that on the basically mid urethra, and then we tie it to the anterior rectus sheath there. So ultimately, when the patient will cough, and we just put those, tie the stitches together above with the nylon stitches. So ultimately, initially in the first one case, we put it at the bladder neck, but then the patient had problem in passing urine. There was retention of urine, so there was problem. So then we started putting it at the mid-urethral level. And initial hitches were there when we started doing the work. So one patient had hematoma, so because there is a lot of dissection in this case. So then we started putting regular drains. So now we have standardized, we have done almost 20 cases last 3 years now. It is well established. It's the patient's own tape, well taken up by the body. There is no reaction and all. And we can leave a drain there for about 48 to 72 hours. So there is no hematoma now. We leave the catheter for about 5 days. That is streamlined now. And after 5 days, when we remove and we give routine antibiotic to the patient like ciprofloxacin, tindrazole, etc. And ultimately, then we can basically remove this catheter and all the patients are very much satisfied. In all the patients which we did, our thesis, this study has just, in fact, yesterday only it has come in the European Journal of Obstetrics and Gynecology. Our study has been published, sir. Yesterday it came online, so all of you can see the study on European Journal of Obstetrics and Gynae. So in fact, the editor wrote me a personal letter that it's a good thing, because now when I went to UK about 2 months back, I went there to learn from them that any new method for SUI surgery, but they are these tapes are no longer available there, and they are forgotten, so they were not offering anything to the patient other than these Kegels exercises. So they say, Dr. Sharma, you can teach us. So in fact, I taught them in the lecture and all. And so about burst colposuction and this new rectus fascia sling surgery. So the paper was immediately accepted, already published in European Journal of Obstetrics and Gynae, so whole world can see it. So I'm very happy that we Indian, and I'm grateful to Dr. C.N. Purandare and his predecessors, who started this Purandare psychopexy. So that same tape we are using for SUI surgery also. So I'm proud of being, an Indian, and Indian gynecologists have been, may it be Dr. Sirodkar, may it be Purandare's family, maybe Dr. Sonawala. So and in vaginal surgery, neurogynae surgery, all the slings you see, Purandare psychopexy, Sonawala sling, Sirodkar's sling, and then Dr. Virkut's sling. So most of the sling surgeries have been done by Indian, Dr. Khanna sling operation. So I think all of us can do something for this. Thank you very much, sir. Thank you.
Can I make a comment here, Niranjan?
Yes, sir.
Having last 5 years traveled so extensively all over the world, I can tell you that as far as the surgical technique is concerned, Indians are the best. There is no two ways about it. There is nobody in the world I have seen surgically so perfect and good other than Indians.
Thank you, sir. Thank you. Absolutely, sir. And especially in vaginal surgery, sir.
So that was wonderful, Dr. J.B. Sharma, and it's going to be a pioneering technique in future in urogynecology, and I'm sure you are going to, once it gets published, to tell all of us, and we are going to hear from you live. So it was wonderful talking with each one of you that one interesting case. And thank you all of you. Now we go to the second round. And it's amazing to see again Dr. R.P. Sonawala, sir. Sir, I hope you can listen to me now. Okay.
Yeah.
Well, sir, it was so nice of you to join us today. And we have heard from you that one case of iconic, the sudden obstetric collapse. And then your Sonawala's loop, which was there in those days. And you conversed with me yesterday also regarding so many mothers who had come, were dying of, women, unmarried girls also, unmarried ladies and married ladies, but they had a lot of septic abortion. And that's what changed the whole scenario. So I want to ask you one thing. What thing in your life you can unturn that event which took place, which should not have happened?
No, there are a few events, but the one which I can quote, that happened in 1986.
Yes, sir.
When a celebrity of Bombay was looked after by me for her pregnancy. It was a very precious pregnancy. She had multiple fibroids, plus she had abdominal problems. We delivered her normally. So I was very, very happy because there was a talk in between, okay, would it be better if she flies to US for delivery? That was her family's intention, but she said definitely not. I'm more comfortable in India and more comfortable with my doctor. Then everything went well. Third day she went home and normal feeding. Then after 10, 11 days, she started developing temperature. And that time, the doctor in charge and the family took it very lightly. Somehow I felt not so good. I thought of breast abscess, then I thought of local infection. But at that time, there was viral encephalitis and going around, and we had a big problem of that in Beachcandy also, when many neonatal babies we lost because of encephalitis. So I advised to come to the hospital. They kept delaying. Okay, no, it's like a common cold, it's common to cold. And then finally, on the 16th day, when they brought her to the hospital, she was absolutely collapsed. And there was bleeding from the nose, bleeding from needle and puncture points. But to my good luck, no bleeding from the uterus. And in the hospital, I immediately called a colleague to be there to examine and give an opinion, because sometimes you might be missing something. So she also examined. One incident which I would like to mention, this is the time when you have good colleagues and you have colleagues who are not so nice to you. It's gone.
Yes, sir,
Yeah.
we can hear you.
You can, were not so nice. So they were the colleagues who were spreading false reports and everything. It was a bad management and bad this. And the investigations at the hospital showed it was encephalitis. And at that time, in Bombay, we lost a sister at Wadi Hospital. There was a sister at Bombay Hospital who died of viral encephalitis, and we could not help, and we lost her. And at that time, the media is the main enemy of yours. So in the morning, a big headline on the front page, due to neglect, so-and-so, we lost, and Dr. so-and-so responsible. And just to make it a little more interesting, at that time, late Mr. Dhirubhai Ambani was quite nice to me. We used to meet and chat and talk. At 6:30 in the morning, he phoned. And he said, "Doctor, have you seen the paper?" I said, "No." So he said, "Please, when you see the paper, don't pay any attention and don't reply. This is the message I would like to give. Because media wants you to reply, and then there'll be a correspondence going, you will be writing, media will be publishing something, they'll twist and turn it. So don't reply." And luckily, the patient's family also very, very cooperative and just told me, "Okay, we don't worry, we know everything was wrong and nothing was wrong with the delivery. And because in the family, two other members also had severe cold, cough and headaches, and it became all right." So that was a big, say, injury to my thinking that a person, everything goes well, obstetrics, normal delivery with multiple problems, and to lose the patient after 16 days due to a medical condition. And that I would prefer if we could reverse.
Thank you, sir. It was really real-time experience which we also saw, and it was so nice on your part to be a good doctor, a doctor who is dedicated his life, and such situations can occur in any obstetrician's life, but that is what the message has to be given to the younger generation. You have to be calm, you have to be patient, you have to be at that particular moment very calm, and that's how when the waves, the thunderstorm comes and there are issues about all these situations, we have to be very nice and be cooperative to everyone. And I'm sure, sir, you sailed through it and you are still there and you are still at the highest point of your career. And thank you so much for that, pouring your heart and explaining to all of us. We'll come back to you soon, sir. Now, I would like to go to Dr. C.N. Purandare, sir. Sir, we want to know that one thing which you did, that is Purandare's modification to radical hysterectomy, and I was a witness to that paper in Washington DC, FIGO, when we both were there together, and that's when I went through that paper. But I want that to be known to all the viewers. The viewers want to know, the nation wants to know that modification, sir. Please go ahead.
Going back over the reason why I started doing it is that way back in 1980 when I was in Ireland, we saw all the radical Vadam hysterectomy that were done. Ward metastasis was a very common occurrence there because the adequate vagina was not removed and so on. I suggested to the consultant under whom I was working that why not do the vaginal dissection first before doing the radical hysterectomy. And one of the pathologists who was the consultant there, a good friend, who has remained a good friend now even today, who is one of my very closest friends, said that he had a special dye which he could inject in the lymphatics to see where the lymphatics were going. So what we did was, in one case, we dissected the posterior wall first from below and did the radical hysterectomy. And the second case, we removed the entire circular incision on the vagina and separated the specimen part of the vagina and the other part of the vagina. He demonstrated that the lymphatics where we had not inside the vagina were going beyond the vaginal edge. And obviously, while manipulating the uterus doing the radical hysterectomy, some microembolization of lymphatics was happening, and therefore the end result was that the vaginal metastasis was seen. So as a routine from then onwards, I started doing first the vaginal dissection, take a circular incision in the vagina, taking adequate vaginal area to make sure that the tumor was away from it, close that completely and close the part, the proximal part and the distal part separately, keeping the roller pack inside between the bladder and the cervix and between the cervix and the rectum. A long roller pack which I kept in, and just closed from below and went abdominally to do a radical hysterectomy. The moment we opened the cervical uterine fold, you could see the cervical fascia once you remove the pack underneath, and if you pull the anterior part of the pack and posteriorly you go very well down, low down into the pouch and open it and take the pack out from posteriorly. If you were to pull that entire pack out of the incision with the specimen, the whole specimen literally came out, and you were able to dissect the ureters, the uterosacral ligaments to go very laterally, and the entire dissection was complete without any problem. And as a routine, in all these radical Vadam hysterectomies, we ligated the interiliac artery. So there was no bleeding at all. It was a bloodless surgery that happened, and we removed all the lymph nodes, the specimen, etc. And saw that the incidence of the bladder injuries and the rectum injuries were literally nil because it was dissected from below, the way we do it in a vaginal hysterectomy. And also the wart metastasis was literally nil because of the vaginal upper 1/3 or even little more if you wanted to being taken care of from below. Surprisingly, I did present the case, the study at PO, and I've done more than 300 cases of that with 92% 5-year survival rate. But what was interesting was that I think around 2012, somewhere around that, in Tata Memorial Hospital, there was a surgery workshop where the cervical laparoscopic dissection was shown, as well as the open surgery was shown for cancer of the cervix. LeBlanc was there for doing the laparoscopic surgery, and the Hong Kong lady was there, who was at that time chair of the oncology committee, was there to do a radical hysterectomy for abdomen. Now, while LeBlanc was doing that, he dissected everything laparoscopically and he said, now I'm going to stop. I'm going to dissect the vagina from below, cut it open, close it, and then I'm going to do the rest of the surgery from above. So I said to him at that point of time that in year 2000, I mentioned it in the FIGO meeting, my technique of doing it, and I have been telling all the oncologists of this country that that is the way forward. Nobody seems to be listening. They feel that they can dissect everything completely from above, and this is nonsense trying to do from below and above. Obviously, they are not vaginal surgeons, so they found a way out to do it abdominally and not do anything vaginally. So when I mentioned that, LeBlanc said that, Professor Purandare, let me tell you something. Now that I have said, from France, LeBlanc has said that vaginal dissection should be done, all of them will now agree because I am from abroad and I am not from India. And that is really the crust when, as a FIGO president, when I landed there and I said, we have to put ourselves on the map there to know that we are the best. There is no question about that. Thank you.
Absolutely, sir. I agree, and we are also following the similar lines and sign. It's not complete totally because to give justice, and especially I have seen those cases which come back with the vault metastasis which occurs, and I've seen those things happening, and it's unfortunate that even in the best hands of the surgeon in doing a radical hysterectomy, but if you leave that part. You can have the recurrence coming up with metastasis in the vaginal vault. So amazing, sir. I think today everyone is listening, and I'm very happy and proud that you gave a foreword to the Gynecologic Oncology Simplified textbook which I wrote, for the Foxy in the year 2013. And along with you, there was Dr. P.K. Shah sir, where I worked with him for about 12.5 years, and really an amazing person, where we went through those Vardheim's radical hysterectomy, and we did more than 80 of them. So thank you so much, sir, for exploring that publication back again in the year 2000, which you did, and now we are in 2020, and it was amazing that you're right. You proved and you said, yes, in FIGO I will go, and that's what you have changed the whole dynamics of the radical hysterectomy. Thank you, sir. Now, we come back to Dr. Balamba. Balamba madam, I want you to share your Hyderabad experience, which you had told me yesterday, about treating women of adolescence with anemia, and how you have gone and taken it further ahead.
Not only adolescents, even pregnant women,
Okay.
Even the first trimester, they come with severe anemias. And there is absolutely no class creed difference, no religious difference. I don't know, anemia is so rampant in our country. Oxy has taken it up, and IMA has taken it up, but still we see so many anemic women. And unless we start treating these girls, right from adolescence, we are not going to improve them. I think, in the school health program, of course, anemia is added on. And we had a national anemia eradication program also, where 100 tablets of ferrous sulfate was given. But then, many people were not even taking that. But I am very happy to say that the injectable iron has come into picture. And in the beginning, we were giving only iron sucrose. See, any hemoglobin less than 8.5 grams percentage, the gastric mucosa also atrophies, And if you give oral iron, most of them have reactions. They have constipation, they have vomitings, they don't like to take them. So in this was a study done in NIN, the National Institute of Nutrition in Hyderabad. So that is when, they started giving, because in good old days they gave Infron. But then, it was very difficult because it has to be given intramuscular, and IV infusions were becoming very, very difficult. So once the iron sucrose came into picture, we started using that. But then, we had to give multiple injections. Then came ferric carboxy maltose, and that I give. And of course, there are some precautions which you have to take when you give ferric carboxy maltose. What I do is I give 1000 milligrams in one go, so that, they need not keep coming again and again back to us. And not only in obstetric patients, even in gynec patients we are doing it. Actually, we started it first in gynec patients. Then we were using only iron sucrose in pregnant women. But then, we started using ferric carboxy maltose even in pregnant women. We didn't find any reactions. But what you have to do is, you start the infusion, then add the ferric carboxy maltose to the infusion bottle. Then, and you have to keep up the time. It has to be finished. 1000 milligrams have to be finished within 20 minutes. The more the delay, more the reaction. And most of the reactions are only rare, very rare, and which can be treated with hydrocortisone. And I have been using, I think, tons of ferric carboxy maltose by now, and we never had any mishap because of the ferric carboxy maltose.
Thank you, Dr. Balamba, and it was great hearing from you the Hyderabad experience, and I'm sure things are going to change now in the future. I think they have already changed. What anemia treatment was there before 20 years back, 10 years back, now it has totally changed. It is all parenteral iron, and I would like to appreciate here today the sponsors who have been so kind, and they are generous that they are not put anywhere their name of the product or the drug, but just they have given a kind gesture, and to the icons of India who are present today. Thank you so much, Emcure, for that kind gesture of yours. Now I come to Dr. Atul Munshi sir, the Lion of Gujarat. And he is going to discuss something innovative which he did many, many decades back. And I want to hear from him live. Dr. Atul sir.
As far as anemia is concerned, I like to add 2 or 3 things. Year after year, all presidents have motto of removal of anemia that I saw from 2007 onwards. In 2007, when I was vice president, the dictum given was 12 by 12. So it was adolescents, 12 grams to 3. Then came a dictum of 375 into 7. And then came the era of postpartum anemia treatment. And all these things, from oral, we have switched to injectable and then to intravenous. In our days, when iron dextran was there, it was very difficult because a lot of anaphylactic reactions were occurring. People were not even ready to take intravenous when iron sucrose has come. It has become so safe. Now, almost we have reduced our blood component and blood by 80%. That is probably everywhere in India. As far as my journey was concerned, in days when we started in 80, it was a routine to give vertical incision for any type of abdominal surgery. That was the time we started with my senior Dr. Vilaspan Mehta, that it is better to go by a transverse. It was a very new one, and fortunately for us, it has picked up very well in our part of it and then everywhere in the India also. And that made us popular also. A lot of people wished to come, and we also started initiating subcutaneous thing. That is was another thing which was very important, and that gives us. And secondly, very busy OPD, it was not very common to counsel the patient. So if you take 5 minutes to counsel the patient, that also makes a lot of difference. That patient, doctor is talking to you. Nowadays, the counseling has become completely routine. In olden days, we used to tell them that in Western countries, they spend about half an hour for counseling and they see only 5 or 6 patients. But that has come us, and medical problems are also reducing because of this. So type of incision and counseling, this has made a lot of difference as far as my practice is concerned.
Wonderful, wonderful explanation, sir. And it is so great to hear from you all those the efforts which you have taken for women's health. We will come back to you, sir. And now, Dr. J.B. Sharma. Dr. J.B. Sharma, you have been doing wonderful work in the field of COVID era. And I would like to hear from you what is happening in yours. The nation wants to know what is happening about the COVID patients and how is it reducing? Has it really reduced? Because we are all worried in Mumbai, in Delhi, it's still very high. The rates are very high, but I'm very happy to tell you in Mumbai, last 3 days, we have got very less cases coming up from Mumbai, especially from Dharavi, Kurla, Govandi, and even Malad. So, we want to hear from you, sir.
Yeah, I think Mumbai and Delhi are the biggest sufferers of this tragedy. But definitely, we were the first one to do cesarean section on a COVID patient and to deal with a COVID patient. But luckily, from the very beginning, I mean, my seniors and our family colleagues and directors, and also we started triaging these patients from the very beginning. So we developed a separate, like we have a trauma center which was converted into COVID hospital. Then we developed a separate suspect area also and normal patients. So from the very beginning, we divided the patients into 3 categories. Those who were totally normal. At that time, of course, we were not doing testing routinely on them, but we from the symptoms. So we were taking them in routine labor room and all. But those who were positive patients went straight to the COVID hospital, and those who were suspect or unknown patient and or coming from that area, we would put them into the separate COVID suspect area. So that actually helped us a lot in avoiding spread of infection to our doctors, to nurses, and all. We did have 2 nurses positive in our labor room, but luckily they did not get it from the patient. Probably they got it from their areas in the stay. One attendant was positive. Probably he got it from his home rather than from the hospital. But we do have some people. One of our fellow colleague in urology developed the infection. He operated on a patient, but again, possibly he got it from one of the attendants. So now, luckily, the things are getting better. People are not that much scared, of COVID anymore. And in daily statistics, as you are saying in Mumbai, the number used to be like 4,000 each day. So for last 2 days, it is decreasing to 2,500 and even lesser today. So probably the worst is over, but of course it's very, very difficult to say. July is going to be very, very crucial. Our director also says that. So July is going to be very crucial, but probably the worst is over. Probably, I will say with guarded words, we can't predict this thing. but probably things will get better only with time. But certainly there is no place for complacency, and all of us have to be extremely alert. And in alertness, I mean, whatever, like today also I was examiner for MD. So we took exam of AIMS Rishikesh, then we took exams of AIMS Jodhpur. So both were done on the online. And today I went to Safdarjung Hospital. We took the exam, but again, no actual cases were given to the doctor. And we had kept two tables in between the, I mean, like the examiner sitting on one end and the other examiner sitting on the other end. So there was 1.5 meter distance between two examiners and more than 2 meter distance between examiner and the candidates. And all of us were wearing N95 masks.
Very
So I mean, and we didn't give them actual, this jars and all that, because that will be contaminated, and we were wearing gloves while we were giving them instruments, and we showed them the specimen was actual specimen, not given, but the photograph of the specimen was and knew this thing. So that is safe for the doctor, safe for the assistant, attendant. That is the biggest I can ask the patient.
Sir, amazing, sir. That's why they call AIMS as a premier institute, and you are always the torch bearer. And even you have conducted the way the exams has to be done for MD. And I'm sure there are many medical professors who have logged in and are hearing, and that is going to be helpful to them to how to conduct an exam, and especially how to go about when we are doing postgraduate, because the postgraduates are still stuck up, their exams are not being taken, they are still doing COVID duties, and I absolutely agree.
Sir,
that,
if you permit me, if you permit
yes,
me, in fact, 3 days back we took exam of our Urogeny fellow, and she was COVID. Her exam was to be on 16th, and she rang me on 14th. Sir, I am COVID positive. So have a guess. I mean, the 16th was the exam, and the candidate is COVID positive. So she got it from her husband. Her husband was positive. She was positive. Both children were positive. Maid was positive. And then, so what to do? So it was a unique case, and then we decided, and it was not actually, the candidate cannot appear on exam from home. So the exam department will do that, so we started, and then luckily we could postpone it. Initially we postponed it to 25th of July, and then COVID testing was done on her. She became negative. So even then we took precautions. So we took it on 30th of June. So we delayed it, and then our medical department and infectious department said that she is totally safe to be on. But still we took all these precautions. I mean, she was 2 meter distance away from us, 2 meter distance, and the examiners were also away from it. In fact, one of the examiners was from Mumbai only, Dr. Ashok Anand, Professor Ashok Anand.
Yes.
Examiner for her. So it was done. So, but I mean, so what I mean to say, even for COVID positive doctor, we took the exam, and all of us are safe. All of us are safe. So
amazing, sir. Sir, I want to thank you. I want to appreciate that in spite of all these efforts that you are going today, you went today to Safdarjung, you conducted an MD exam. Previously, you also conducted the Urogynec exam, and the COVID positive candidate, you took that exam, and it's amazing. I think that's an important message, that in such situations also they can give an exam. Only thing is that they should be taking proper precautions, and that is a way you have given us for all the examiners and the professors who are there. So there's nothing to worry. We just have to be very cautious for the next 1.5 months. So I think we have finished the second round. We have heard from the gurus of guru, the icons of icons. We have heard about the Sonawala's loop, the evaluation of radical Vardine hysterectomy to the next level of Purandare's modification by none other than from the FIGO chair, Dr. Purandare. And we have heard about that 8 fibroids, which turned out to be 82 fibroids from Dr. Balamba, and obviously Dr. Atul Munshi. That was a wonderful case discussion which you did on the abdominal pregnancy, which is still alive and kicking. And Dr. J.B. Sharma, that invention of yours in the field of urogynecology is going to be seen, and it is going to be a landmark surgery, sling surgery, which we have seen. So what a journey it was to go through all of you, and the way you have managed it. I mean, they say that there are current heroes like Kartik Aaryan, Sara Ali Khan, or you can take the names of even Hrithik and Tiger, and they only can make the movies which are hit. But today we have proved that we have also our own Dharmendra, Amitabh Bachchan, Rajesh Khanna, Hema Malini, and we are there. We are nothing less than stars, and I'm very proud that on Guru Purnima Day, icons of India have been there. And you are not old. You are surely gold, and you are a gold mine of science and technology assimilated together, and the learnings which you have taught all of us. And I would like to thank Emcure, who have been so kind enough and generous to be there with us today. Thank you so much. But before we leave, we want to hear the take-home messages from all of you. What message you would like to give to the younger generation? So I would like to start from Dr. Sunawala, sir.
Our first responsibility is to the country, nation. And for that, every doctor should get involved in controlling the population. Unless we control the population, actually not only the country, but the world has got no prospect. Just imagine 1 billion in 1800 becomes 2 billion to 5 billion in 1900, and now 7 billion in 2000. So every doctor has to put his shoulder to control the population. And number two, to the doctor himself, look after your health and you a very successful doctor. And the last thing is greed and arrogance. If one has got greed and arrogance, you cannot become a human being. You are not worth whatever heights you have achieved are not so important the moment you develop greed and arrogance. Medical profession is a service. It's a service which does bring us a certain amount of income, and one should think of the underprivileged to be looked after as well in your work. That's the message I would like to give to the modern generation.
Amazing, sir. Those words touched our hearts, and really, you have told that greed and arrogance can make you nowhere, and you have to be down to earth. Thank you for that wonderful take-home message. Dr. C.N. Purandare, sir, your take-home message for the younger generation.
I think honesty, dedication, and hard work. Hard work, and hard work is the key to success. There are no shortcuts in life. You have to really work hard for whatever you're doing. And that honesty, when you show it to the patient, they know that you're doing best for them, will definitely take you a long way in working with your patients, and the patients appreciating that you are doing whatever best that you can. So that is something which I must say the basics one must realize in. And as far as what Dr. Sonawala said, there is something in him which women just go for it. I don't know what it is, but all the patients love him, and that's really the key for his success in his profession all these years. And that humility, I think that's really something which is shown, even though he has been such a great obstetrician gynecologist, icon, world renowned, and that's something which I think would be a take-home message for all the students.
Sir, I appreciate your wonderful pearls of wisdom and the gems which you have given today. I would like to tell you, sir, the audience has gone more than 2,000 today, logged in live viewers, and there are few messages for you, especially I would just read them. Dr. Narendra Malhotra from Agra, he has said to you, sir, it was great 3 years for all of us Indians when you were there at the helm of affairs of FIGO, and thank you so much. There are comments from the Gynae Oncology Chair, Dr. Bhagya Lakshmi, on the occasion of Guru Purnima Day. I'm seeing all those icons of India. Thank you, Niranjan, for making it possible. And sir, there are messages from Hyderabad, there are messages from all over India which are coming for you. Sir, I still remember the efforts which you have done, especially when we had to perform in Mumbai Obstetric Gynec Society on the International Women's Day, when the call was given by our Foxy President, Dr. Alpesh Gandhi, that we are supposed to screen and please go ahead for those women, especially the police women. And sir, you immediately came and you made us all run, and we were running from pillar to post for getting that permission, but just one phone call and to the police commissioner we went in the afternoon, myself and other office bearers, Foxy Secretary General. And sir, it was so wonderful that you made that possible, and we could get the permission for 17 centers, not only in Mumbai but in Maharashtra. And that is what is CN Purandare. He can do it, and he is going to fight for it. And that's what, sir, we have seen, and that is an inspiration which you have given to all of us. Thank you so much for being there, sir. Thank you.
Thank you, Niranjan.
Dr. Balamba, madam, your take-home message.
The younger generation first should start practicing ethics. Ethics is very important in your practicing, and ethical practice will go a long way. What Dr. Sonavala has said, greed and arrogance is going to be your downfall. So be humble and always have a thirst for learning, and respect your patients and listen to your patients and develop communication skills. Fame and money will come to you as you go on and as you gain more and more experience. But don't aspire for that right in the beginning of your career. Try to learn, and keep learning all the way till you are going to give up your practice. That is my message.
Amazing. Thank you, sir. Thank you, madam. Dr. Purandare, for those words of hard work. And madam, for the thirst of learning and respect women. That was a very important message which you have given. And I would like to ask now Dr. Atul Munshi the message to the younger generation.
We are dealing with a mother to be, the fetus, and the anxious relation. So you have to be very careful. The word I like to use it, remain up to date as far as your grooming is concerned. You see Dr. Sonavala and Dr. C.N. Purandare, your patient like to see a doctor which is quite very well groomed. Remain up to date as far as your workplace is concerned. Don't like to be in a shabby place and working. When Dr. J.B. Sharma, we know that how he is working. The third thing is remain up to date as far as your knowledge is concerned. Skill and operative skill should always be, make it ready every day. It is not that you keep investing in your relationship. You should have a good relationship with your patients, your relatives, and you should have a good relation with your family members also. Don't forget them. And last but not least, everybody has said, keep good investment as far as your health is concerned. Lastly, to the patient, people who are saying, we are in a very difficult situation, but you must have invest for ourselves also. Anytime you might get this type of thing. So remain up to date, invest in proper way. Not only invest money, but invest as far as relationship is concerned, invest as far as energy is concerned. Thank you.
Wonderful, sir. I got those messages from you. You have to be updated. You have to remain up to date. You have to invest not only in money, but invest in relationship and do your skills. And that was wonderful message which you have given. So greed, you don't be greedy, don't be arrogant. You have hard work, you develop skill, keep learning, remain up to date. And that's what is most important, to respect women and your patients. Now we come back to Dr. J.B. Sharma.
Yeah. Yes, sir. So I'll take little longer here. Yeah. So in fact, I was in UK, sir, and then one of my consultants in St. Bartholomew Hospital told me with pride that he learnt this cervical incompetence surgery from none other than Professor Sirodkar. So Professor Sirodkar had gone in 1964 to St. Bartholomew Hospital, London, to demonstrate. So I was so proud that some, like an Indian can demonstrate surgery to foreigners. Similarly, last year I used to visit Mumbai, so I saw Purandare Griha from outside. I couldn't dare. I was a student, medical student. So I said Purandare's Griha, and Foxy runs from there. That can I also become something? And now I'm happy that CN Purandare also recognizes me. At that time, I couldn't dare to knock the bell, sir. At your room. So, but that family and Purandre's operation and all. And then, last year I was visiting the UK King's College. They were using Sonawala jet speculum. And then the surgeon there, he told me with pride that, Professor Sonawala, do you know him? I said, yeah, so many times I have met, sir. So, sir, all those things, made that, okay, can also do something to be, innovative like that. So then I developed this modified Leopold maneuver. I modified that and I sent it for publication to Archives Gynae. Professor Hans Ludwig was the editor. So he said it resembles, but it is different because you are, comparing it with something which Leopold did not do. And that's how I got it. So ultimately, he published my paper in Archives Gynae, Sarma's modification of Leopold technique. And similarly, then I said, okay, in which book is it written that, the sign will be Murphy's sign only? Why can't it be Purandre's sign, Sonawala sign like that? So we Indian can also have name.
Yes.
So I developed signs for, genital tuberculosis. So when I put a laparoscope in, I always 360 degrees I rotate. So the hard work, sincerity, honesty remembered. So you can also see, I keep getting letters from Australia, from New Zealand, from China, from USA. I got a letter from a doctor from USA, San Diego, that Dr. Sharma, can you help me? I got 3 patients, all wives of Indian software engineers who have got genital tuberculosis and I have no clue how to treat them. So I sent him my paper and all, and he showed me. And so we can show them the way in vaginal surgery. We can show them the way in genital tuberculosis because learning from Sonawala, and also we Indian can also have faith in you, work honestly, sincerely. When other people are sleeping, I remain awake till 2 o'clock or get up in the 5 in the morning to write books and all. So there is no easy way out. Unfortunately, I'm sad to say that youngsters these days, they want easy way out. They want to do a profession like computer and all, so that they can, with less work, they want to earn more money. My children also sometimes fight with me that, Dad, what is your take-home rate? At the end of, you work so hard, but at the end of month, how much salary are you getting? So I said, beta, you can't, you can't compare that, but it gives me satisfaction. So you may earn more 5 to 10 lakh rupees a month, in some job in which you are working hard. But I said, what I'm doing is I'm doing with passion. So my message to the youngster will be, you have to work hard. You can't be CN Purandre in one day. You see how much hard work for Professor Sonawala, so you have to work hard. You have to have faith in you. Be honest, dedicated, and don't run after money or fame. You do good work, people will automatically follow you and you will be known in the circuit once you do good work. Thank you very much.
Amazing. That was wonderful. All of you were so fantastic. There are many youngsters who have joined today and they have heard from you that money is not everything in life. It's only hard work, and it is those skills which you have to develop as you grow, and you have to have investment in your relationship, and don't be greedy. Be honest to yourself, show that humility and develop skills, keep on learning, remain updated, invest in your relationship, time, and not only in wealth. And that's what we do, webinars to give you free updates. We are not doing anything else, but we are giving you free updates, and we try to endorse, and we are trying our bit to endorse these words of such an icons of India. We are amazed by all the efforts which you all have done and contributed to the field of obstetric and gynecology. And I can still remember Dr. Purandre is still working on that HCQ module of ICMR, and there are surveys and there are questionnaires, and we are getting good results. And thank you, sir, all of you. It is not only money and fame which is important in life, but these are all the gems which and the pearls of wisdom which have been given by our icons. So I am really in debt to all of you that you have given your valuable time to all of us. Being a Sunday today, and we are pouring cats and dogs in Mumbai, and it's amazing that it's very heavy, and as the rains are very heavy, we had a huge audience, and this is consecutively happening for the 3rd day. We have got complaints of waterlogging. There are reported areas with all these issues, but we are fighter. Mumbai has got a fighting spirit, and I'm sure all the states and the cities and towns of India are ready to fight with COVID and these rains. So thank you so much, all of you being there. Now I would request Dr. Omkar Swami to take over and give this vote of thanks. Thank you.
On behalf of all the speakers, I would like to thank Dr. Chavan for conducting this so well. And Emcure
Excellent coordination. Excellent
organizing.
We all endorse that. Endorse that.
Absolutely.
Really enjoyed your
Thank you. Thank you.
way you have conducted.